Hi, today I'm going to talk to you about what the difference between dry needling and acupuncture is. This is a very common question that I get as a Chinese medicine practitioner and acupuncturist and herbalist. Patients come into me and say, oh, I had acupuncture from somebody else that wasn't an acupuncturist, and it turns out that it was actually dry needling, and they just didn't really know the difference, and the practitioner didn't explain it to them properly. To explain that there was a difference, or maybe use the word acupuncture to help them understand what it is, because probably acupuncture is more well known than dry needling, so people can associate something. When you're trying to explain something different to people that they don't know, something new, you want to give them something that they do know, so you attach that sort of meaning to it so it helps you understand. So today I want to debunk some of the myths, or just maybe give you some information that you may not have known. So especially if you're already seeking some sort of treatment for your problem, this may help you make a better decision to be able to do that. So we're going to follow along with the slides that I've made there. The first one kind of shows you a whole bunch of circles there that you can see on the screen. So basically what that chart shows you is that there are lots of different things as part of Chinese medicine. Acupuncture is a part of Chinese medicine. Dry needling is a part of Western medicine. So this is a big difference. Now, it doesn't mean that Chinese medicine practitioners don't understand your body according to Western medicine. They certainly do. But the entire framework of understanding of our body is just a different way of thinking. It's not a mystical way. It's not a woo-woo way. And there's lots of misconceptions within even Chinese medicine, and there's a lot of disagreement with Chinese medicine practitioners. So it's no wonder that patients are confused. It's no wonder that even maybe yourself you feel confused, and that's maybe what's led you to watch this video. So the first thing we can see there in that circle is that Chinese medicine is a different way of understanding the body. It's an observational way. Some of these things could be misconstrued as woo-woo. Like I've seen on lots of websites where dry needling people are explaining the origins of Chinese medicine as meridians and qi that flows through the vessels. Those are Chinese concepts. Those are words that were used back in the Han Dynasty and pre-Han dynasties to kind of explain different things, but actually there's different translations for those words. It doesn't necessarily mean like a mystical force that flows through your body. It's just a different way of explaining how blood moves through our body. And essentially what acupuncture is going to do is it's going to get blood flow to the area. Now dry needling kind of does that as well, but it's just in a different way. And the diagnosis that forms the opinions of the practitioner is a completely different system in both of those things. So Chinese medicine is based on this understanding of yin and yang. It's based on the 5 elements, which is a theory of how our body interacts with the environment and ourselves. Now, this stuff that I'm showing you here in this circle is literally a whole year of study for a Chinese medicine practitioner. Like the first year of study, they're just learning about these things, and even blending into the second year, they're still learning those things. I'm a teacher. This is what I teach at Chinese medicine school, and so the ZANG-FU organ theory is the understanding of how our organs function according to Chinese medicine. So it's just a different way of thinking about things. It's not a woo-woo or some sort of like mystical force. It's just a different way of understanding how things work. The Bagang is the 8 principles. So students learn all of these different things before they get on to the next bit, which is diagnostic methods. So in Chinese medicine, we use different methods of diagnosis to the framework of Western medicine. A practitioner may look at your tongue. They're going to take your pulse, which is a different way of even taking the pulse to in a Western medicine sense. A lot of patients even ask me that, like, oh, have I got a pulse, or why are you checking the pulse for so long? Because we're not necessarily just counting the beats of the pulse, we're feeling the different changes in the vessels. Now, I'll have different videos on these things that you can click onto later on, and so you can follow on and learn about those aspects of Chinese medicine for yourself in that way, because otherwise this video would go on for possibly years and years, and you don't want to sit through all that. So it also involves looking. So the looking at the patient, we observe how people look, how their skin looks. Is it dry? Is it clammy? Are they sweating a lot? Do they feel very cold? Like observing, using those observing skills of looking and palpating are kind of part of that. And then in addition to that, in TCM, they have this 10 smart questions, which is this idea that it should be a holistic approach to your body. Now, not every practitioner is going to ask you 10 questions. They may ask you more than 10 questions, and they may ask you different areas depending on what's pertinent to your individual situation. So what I'm getting at is that there's this whole different framework within Chinese medicine, that's totally different to Western medicine. So if you go to a person that does dry needling, they're not going to use the diagnostic methods of Chinese medicine to inform what points they're going to choose to inform, which comes from the diagnosis that they've made. So that's pretty much the first year of Chinese medicine school in the first 1 or 2 years. And then a practitioner also of Chinese medicine does a lot of training in needling itself. Now, acupuncture needles come in all shapes and sizes, different sorts. Here's a few that I've got here. The actual inserting of the needle is something that requires a lot of training. So because these needles are really small, you don't just buy a packet of needles and stick them into someone. Now, I actually worked with a physio once that did that. And this was a long time ago. This was like back in 2006. No, I think it was earlier than that. It was probably would have been 2003, 2002 or 2003, because I'd just come back from China basically when I was working there. So it probably would have been 2002. Yeah, something like that. 2001, 2, something like that. And anyway, the year doesn't matter. But I was appalled, but I was also very, very young. I was like 22, and I was like, what are you doing? Like, why are you buying a packet of needles and just trying them out on patients because they wanted to do dry needling and they had no experience in now I get that, look, this is just anecdotal evidence. Not every practitioner who does dry needling practices in this way, so I'm just making that disclaimer. There's some people that do dry needling and they've been somewhat trained. There's no way they're going to do a 4-year degree in doing dry needling. Now some practitioners do if they do a musculoskeletal therapy degree. But what I'm getting at here is that in Chinese medicine, students and practitioners spend hours and hours and hours learning how to insert the needle, like how to actually manipulate that needle, how to stick it in. Some practitioners use guide tubes where they tap it in, and that's like makes it a whole lot easier, and then you don't have to really practice this technique as much. But at my school, we never really were encouraged to use guide tubes. We were encouraged just to put the needles in by hand. And so what you have to develop is what's called your finger force. And what you'll see by these pictures here is the force of the needle going, like how strong your fingers are, and what you can do with that is a technique that's honed and that's developed. When I was studying in the hospital in China, when there was no patients coming in, the other students who were there, the other Chinese students who'd done their university degree and they were kind of doing their internship at the same time as I was doing my training, when there was no patients there, they would sit there on a practice cushion and just practice inserting the needle, sticking it in, sticking it out, using, basically obtaining that finger force and strengthening your hand. And that's not something that I see it ever being taught in dry needling school. So what that does for a patient is it makes it a lot less painful for the needles to go in, because the quicker you can put them in, the less pain the patient's going to feel. But it also makes them the actual what you're going to do with the point and how you obtain that feeling in the point and what you do and how you release the muscle or whatever you're doing with that acupuncture needle, it actually makes it a lot more effective when the person's properly trained or better trained on how to do that. Did you know that there is around 365 acupuncture points on the body? So one teacher I had used to say, well, that was one for every day of the year, right? Remember how to remember that. So roughly 400 points. Practitioners would learn every point. They know about every point, but most students would probably come out with knowing around 200 points, and practitioners would probably use between 50 to 100 points, every day or within a week. And then there's probably another 100 or so points that you wouldn't use that commonly. There's some points that we pretty much never use, or very rarely use, I should say. Maybe I can't say never, but so what I'm getting at is there's lots of different points and there's different uses for those points. It's not just knowing where the points are, so the anatomical location, but each point has different functions. So what the points actually do. So this is based again on the Chinese medicine framework. Now there's nothing to do with this in dry needling. It's got nothing to do with that. It's only musculoskeletal. So the different indications and uses. So a Chinese medicine practitioner can, if you come in with a musculoskeletal complaint, let's say like a back pain, they can address that back pain with acupuncture for sure, but they also can address other concerns that you have, maybe even using the same points that they would choose for the back pain. Knowing those functions of what those points are, they can look at addressing other underlying concerns that you might have. It might be things to do with digestion or sleep or things like that. And so that's all meant to be learned and memorized by acupuncture practitioners, acupuncturists. In addition to knowing the locations, the practitioners have to learn these different combinations of points. This is known as writing the prescription. So like you make a diagnosis, and then you make a treatment principle, and then you write the prescription. And then there's lots of different things that are going on within that prescription. So how long you leave the needles in for, what kind of manipulation you do to them, do you use different aspects, which we'll get to in a minute, on top of those things as well. So a practitioner learns the techniques, but then they're meant to hone those techniques. So I've kind of alluded to this already. The 10,000 hour rule is something that's known in many aspects of different trainings. To become a master of anything, if you put 10,000 hours into something, then you can become an expert at that, and you'll become very, very good at that. I would like to see a dry needler who's done 10,000 hours of needling patients. Maybe there are some that exist, and feel free to comment on this video if that's you. But actually sitting there and practicing inserting the needles, like practicing on a cushion, seeing patients and doing that, because an acupuncturist is skilled in that area, and that's all that they do, and they're doing hundreds and hundreds of needles every day, then it hones that technique, and they become very, very good at that. These things in Chinese medicine exist, like when I was studying TUINA, for instance, they told us that TUINA students were expected to roll, TUINA's Chinese massage by the way, roll a bag of rice into flour before you can touch a patient. And they have a similar thing, which is, so you'll see the video of the rolling there if you don't know what that is, but acupuncture students are expected to needle through 10 sheets of paper before they can needle a patient. So it meant that you had to obtain that finger force to be able to get that needle to go through the sheets of paper. Now, I don't have any paper here, I've just got some tissue. But Chinese paper is very thin, that's one thing to remember. It's not like super, super duper thick. But to be able to just basically put that needle in without it sort of bending, or, it's hard on this because it's meant to replicate a person, a patient's body. So basically you're practicing inserting that needle, and the ability to hold the needle with the force of the fingers here allows them to stick it in without bending the shaft, because you can see the shaft of the needles are pretty thin, and there's different styles of needles. There's thicker ones, thinner ones, that kind of stuff. So the honing of the techniques is a really important part of the strategy. The next aspect of Chinese medicine, which a lot of practitioners maybe learn at the start, or part of their training, maybe first year, second year, but then they may go on and do more training. That's something that I've done in my study, is to learn different styles, or particularly hone into a particular way. So this is why also when you go to see a Chinese medicine practitioner, probably just as you see dry needlers, there's different styles. Depends on who their teacher was, depends on what their training was, what they did, how long they leave the needles in, what kind of diagnosis style they sort of subscribe to. There are these general overarching principles about Chinese medicine, but many practitioners go through these different trainings, or they understand the classics of Chinese medicine in a much, much deeper kind of way. So I've just put some classical people there, some interesting characters of Chinese medicine, and that there's nothing to be too concerned about there. Just to understand that is part of it, and there are some practitioners that have devoted their entire life or years and years of training to understand these textbooks, and to utilize that information, make it more available to other practitioners who maybe don't have that scholarly aptitude to. It's really hard to understand the textbooks that are written in the Han Dynasty in that style of Chinese, and know the understandings of how that came about, the hermeneutics of what that actually means. That is part of Chinese medicine, which is not part of dry needling. If we're going to think about classical or a lineage or a basis for it, dry needling's been around not many years, 30 years. Acupuncture's been around thousands and thousands of years. So yeah, and then in addition to that, now you might say, well, Marie, this just sounds like woo-woo. It's all just mystical, or it's all just theoretical or observational, and that's all fine for people that love Chinese medicine, but I want something concrete. I want something scientific. I don't want a practitioner who just knows about Chinese medicine. Well, acupuncturists are trained in Western medicine subjects as well. And there's plenty of acupuncturists who really know a lot of anatomy and the anatomical aspects of your body. That's something that I have taught at uni as well, the musculoskeletal anatomy and how to palpate that, and how to understand that and understand the fascia and the different aspects of the body. So it's a big part of, it wasn't a big part of my degree when I learned, 15, 18 years ago, but it's a massive part of the degrees that practitioners are learning now, to be really informed in Western medicine, very informed in scientific method, to use techniques that are shown to have a scientific backing, if you like, in terms of a research paper that backs the use of those points for that particular disease or ailment or something like that. So, Chinese medicine practitioners learn all this stuff as well, just as much as physios do, just as much as chiropractors do, that kind of stuff. They're trained in the enough anatomy and physiology in a Western medicine sense to be able to understand that as well. Disease pathology, so just things that have changed in your body and the pathomechanisms of that. Also research methods, scientific inquiry, evidence-based medicine. Now this means, I just want to touch on this very quickly, and I'll probably make another video on this as well, because otherwise it'll take up too much time just talking about it now. But research is a big part of Chinese medicine, and it's a big part of Western medicine. Obviously, it's the main part of it, but it's also becoming more and more. There's becoming more and more reliance on it, or advocacy for it. I'll just cut that bit out. So research methods, scientific inquiry, evidence-based medicine. Now these are things that are part of the general framework of Western medicine, and that has leached into Chinese medicine, particularly in Australia. If you're from here, you'll notice that the law has changed recently, APRA law, about what we can and can't say about what acupuncture may or may not be able to help you with, because it needs to be based on that evidence-based medicine, according to the powers that be in APRA, that what they deem sufficient evidence. And that's a whole other topic. I've got another really cool video on that. You can watch that. I'll put that link in the description below. So what that means is students are really trained in how to understand scientific inquiry and how to understand that. One of the things that bugs me about dry needling, and I sort of Google this from a patient's perspective, let's say, so what's the difference between dry needling and acupuncture? And you'll find a dry needling website come up, and the first one that comes up says something like this. Bear in mind that, this is what they're saying, but bear in mind that dry needling is based on scientific inquiry and the principles of science, whereas Chinese medicine or acupuncture, with not seeing a dry needling person, seeing an acupuncturist, is based on meridians and qi, and they're inferring that is unscientific. Now let's think about what the definition of science is. So scientific inquiry. So let's think about what the definition of science is. If you just Google it, and you'll find the dictionary definition. Science is the intellectual and practical activity encompassing the systematic study of the structure and behaviour of the physical and natural world through observation and experiment. Well, there's no greater observation than a 2,000, 3,000 year history of observing something in practice, how it works. That is a massive amount of empirical evidence right there. So that is scientific inquiry. There's nothing unscientific about Chinese medicine or acupuncture. And if anything, the longer something's been in practice, the more amount of information that we have to be able to make a scientific observations about that. And Chinese medicine is deeply, deeply embedded in that model of observation. Practitioners are, not considered good practitioners if they don't apply that observation to their own practice and see as things are changing in the patient. You're observing the progress of that individual patient rather than just banging on with a treatment that you've decided to do because a research project told you that was the right thing to do, and you bang away with that for 6 treatments and then you see what happens. Now, sometimes that does happen, and that can be valid, a way of observing if something works or doesn't work. But the observation level of a Chinese medicine practitioner and the tweaking and the changing of the treatment is, on an individual level. And that is actually not something that Western medicine scientific inquiry can encompass, because it kind of goes against that aspect of scientific inquiry, which is, they want to minimize a lot of variables in that way. Anyway, I don't want to rant on about that stuff too much, but just so you understand that an acupuncturist or a Chinese medicine practitioner actually understands and is trained in Western medicine, in biomedicine, as well as all of these things in Chinese medicine. So if you have a look at this big chart here that I've got, Chinese medicine, it's actually all of these things here. Now, within Chinese medicine, you have 5 branches of treatment. So a practitioner can learn all of that stuff we've just talked about, and then they could either learn different things, or some practitioners specialize in only one thing. So some practitioners only do, for instance, Chinese herbal medicine. Some only do acupuncture, or some practitioners really specialize in diet therapy, for instance. So Chinese diet therapy is in the second one, using foods as medicine and how to help people with that. Qigong, Tai Chi, exercise therapy, that's another branch of Chinese medicine. That's often used as a preventative aspect. And TUINA, Chinese massage, is a manual application of using like the practitioner's hands to manipulate those points and actually, cause an effect by that, rather than using a needle. Now, within acupuncture, you'll see in this circle, there's a lot of things going on here. So you'll see that an acupuncturist learns about cupping. There's all different kinds of cupping. We have slide cupping, fire cupping, all that kind of stuff. They have auricular acupuncture, which is acupuncture in the ears, so using points in the ears. There's different styles of acupuncture. There's a French style, there's Chinese styles. Within the Chinese styles, there's lots of different other styles, like there's lots of different aspects. Now, the most common way to use an acupuncture needle, is to stick it into the identified acupuncture point. And this will activate the benefits of that point, as well as the local circulation of blood, release endorphins, and have a pain-releasing function, usually, depending on what we're treating. We're talking about dry needling here, so often dry needling is used for pain, so that's why I've mentioned this. It can release endorphins and other hormones in your body. It can also have an effect on the neuroplasticity of your brain and how that works. There's new research coming out showing that acupuncture has an effect on your brain. To be really clear, there's no one method that's known that, hey, this is exactly how acupuncture works. We can show in an evidence-based research method that it does work, or it could alleviate pain to a certain extent for these conditions, or it could have, you do this certain protocol and then this outcome can happen. But there's no one that can actually tell you exactly every time how acupuncture works for every different thing. One of the ways that's proposed, which is there's evidence to show that when a person has acupuncture, that it makes changes happen in your brain, and then your brain's doing the healing. And certainly that is the main thing with Chinese medicine, that we think as a practitioner, we're not doing anything to you in terms of with an acupuncture needle, it's different to taking herbs. You're not ingesting any substance. You're only shifting things around. You're allowing the body to be free from some kind of blockage that's there, so that then it can then do its own healing, or you're promoting blood flow to come there. And it's really your own body. It's your body that does the healing, not the acupuncture needle's just facilitating that change to take place. Alerting your body that there's something wrong there. So that's the filiform needle, that's different type of needle. Then there's also so many different classical and different aspects of needling. And then there's, styles that have kind of developed from that. What I'm getting at is that there's just so many different types of needling. It's not just one thing. So then we get to this aspect of dry needling. So if you can see in this picture here that one of the needling types, and you'll see these circles are kind of showing the overlapping things here. I can just scroll out a little bit there. So you can see in this circle here, you have these 9 classical needles and needling methods from the Neijing Ling Shu. That's what it says on the top of the picture there. So channel needling, distal point needling, collateral needling, heat needling, shoe point needling. Now, I could go through all these different things with you, but we don't really have time to do that. I just want to let you know there's all different aspects, and these are all described, so they've been in use for more than 2,000 years of of use. One of the needling methods is called crack, or let's say, and that's probably a bad translation, crack needling. We're not putting crack in, we're not inserting cocaine into your body or anything like that. Crack needling shares similarities with dry needling. So it's a technique that's very similar. Acupuncturists, so we'll just read this bit on here. So what would be similar to what's known as dry needling are used by acupuncturists from time to time. This is known in Chinese medicine as shi points. So pretty much, if you, let's say you come in and you have a pain, you have a tennis elbow or you have a pain in your elbow, and a practitioner may palpate that, which means to touch it, to sort of feel where's the sore point. And there may be a spot, and then they may palpate along the channel, which is the meridian, which is the line where we know that the points are on. And there may be a point that's not exactly a known acupuncture point. It's what we would call an shi point. And that would be similar to like what a trigger point would be. And there are very common spots where there are trigger points there, and there'll be sore points when a practitioner palpates them. And often when you feel them, they can feel like a little lump of tissue is there, or a little bit of like, you can feel the fibrous nature of the tissue there, and as you roll across, you can almost feel like a crunchy sound sometimes. Not always, but that's common. So needling these trigger points or needling those things, the difference with a dry needler is they purposefully go out to find those points, and that's all that they do. One thing. And also they are just thinking about them from a purely a musculoskeletal perspective. So we'll get to that in a minute. But it would be rare for an acupuncturist just to only needle these points. If a patient came in with tennis elbow, for instance, I may use those shi points. So inadvertently, I may do some dry needling on them. But it would be rare for me just to only do that. So dry needling alone is a technique based on needling painful points and knowledge of the musculoskeletal anatomy. Dry needling doesn't require a practitioner of dry needling to know anything about all the stuff I've just talked about. It doesn't require them to go through all those hours of training of how to insert the needles, which is hence when a person's doing dry needling, we shouldn't really fit it into this framework. So it's misleading for a dry needling practitioner to tell a patient that they're doing acupuncture, because actually what they're doing, it doesn't really fit there. It kind of fits over here, which is in its own area, outside of Chinese medicine. It shouldn't be associated with acupuncture by itself. So we can see here dry needling. Perhaps one way to define dry needling is the application of the concept of shi point needling without any Chinese medicine assessment or training. Now, I'm not saying they don't have any training, they just don't have Chinese medicine assessment and training. So don't call yourself an acupuncturist. Don't say you're doing acupuncture on patients, because really a dry needling person isn't doing acupuncture on people. They may be using the same needle, and we'll get to that in a minute. And the reason why they use these needles, dry needling started with using hypodermic needles. Hypodermic needles are much bigger, they're thicker, they're hollow inside, and so it's going to hurt when it sticks into you. Now, patients aren't going to want to endure a lot of pain for that kind of benefit. Plus, the thicker the needle is, the more chance it has of bruising you, piercing a blood vessel. So when it pierces a blood vessel, then you're going to have a bruise. That is one of the biggest issues with dry needling, is patients get bruises from the points. It can be very painful when it's done. Even when it's done with an acupuncture needle. Why is it painful when a dry needling person does it and not as painful when an acupuncturist does it? Because the acupuncturist has had all those hours of practicing inserting it on a cushion, practicing inserting it in patients, in student clinics for hours and hours and hours before they've come out and actually then gone and said they're going to treat you. So that is one aspect of it. Another aspect is that because dry needling requires a huge amount of knowledge of musculoskeletal anatomy, and they are trying to release particular muscles with acupuncture needles, without the guidance of any like ultrasound equipment or things like that, it can be dangerous because of the depth of the needling required to reach those muscle groups especially like, let's say, in the back. Now, why is it dangerous to try to reach those deeper muscle groups? Because the lungs are underneath there, because organs are underneath there. And there's lots of examples, if you Google on YouTube, dry needling gone wrong or things like that, where people have caused a pneumothorax, which is like a puncturing the lung. Or just having bruises is something. Now, you can go to an acupuncturist and have a bruise. That can happen. I'm not saying acupuncturists don't cause bruises, but it's less likely. It happens less often with an acupuncturist. Like, for me to cause bruises on patients wouldn't be a common occurrence. It can happen, and it has happened, but it's not the common thing. It's not the regular thing. Whereas with dry needling, it's quite regular for it to cause a bruise. Now, that's because they use a deeper needling technique, and they're more likely to touch a blood vessel, and also the training that you've had. So with an acupuncturist, there was certain training that we had of how to avoid causing bruises with acupuncture needles. That's definitely part of it. So the techniques used by dry needlers, essentially is without that framework and that understanding of Chinese medicine. So that's really what I want to make clear today. So that if you're a patient, you're a person that's looking for Chinese medicine or acupuncture or dry needling, or you basically just want to fix your problem, and you're not sure what to have or what to do, hopefully this video can inform you. And I'd love you to leave a comment in the comments below. So the purpose of this video is to really just inform you and to make sure that you understand that there is a difference between acupuncture and dry needling, and that you can use this knowledge to make a better decision, hopefully, to know what's the best thing for you to do in your situation. Thanks for watching.